Limited is an internet service provider with efficient service package for your corporate and individual needs, which includes shared bandwidth and dedicated services. They are located at Barinharin Highway, Bijilo at Sky Blue Plaza. Rush now to subscribe with DK Telecom, a solution provider to all your internet problems. DK Telecom service includes 5 meg speed, 7 meg speed and 10 meg speed respectively, with 30 days unlimited browsing excellence, 24 hours customer service, free support and free installation. For more information on DK Telecom services, call these numbers: 954-4000, 894-4000, 294-4000, 5144-000. DK Telecom, a solution provider to all your internet worries.
Center manager give us his words of wisdom, and then we'll take questions and answers from the media. So we can start, we can play in our individual ways and start the event. May God answer all our prayers. Huh? So now we will allow
the Minister of Health and the entire public health fraternity. I wish to welcome all of you on this very important occasion today. It is very, very important for us to be here to commemorate this short period we have as the Public Health Awareness Week, to enlighten people on what our roles and responsibilities are. I will not preempt, but just to remind you that we are here to discuss very, very important issues, and I welcome all of you to this great occasion, and thank you very much for your time. Over to you.
Good morning, program managers, heads of units, colleague public health professionals, and our dear friends from the various media houses. A very good morning to you all. The Association of Public and Environmental Health Officers of the Gambia was founded in 1971 by public health professionals in the Gambia under the dynamic stewardship of the late Dr. M.B. Jan. The association consists of public health professionals both within and outside the Gambia, with a current membership of more than 1,000. Presently, our members are spread across various ministries of the government, government parastatals, private institutions, and several UN agencies, both local and international. The association seeks to partner with the government and other stakeholders in protecting the health of the populace by embarking on activities that will raise awareness among the populace on matters of public health by offering, 1, technical assistance to some government machineries, or, in some instances, mobilize and encourage our members to partake in various public health interventions in the country. Furthermore, the association also seeks to protect the mutual interests of its members and plays a mediatory role between members and other authorities as the circumstances may warrant. As part of efforts in contributing towards advancing public health in the country and about the importance of public health interventions in keeping our beloved country safe, the association conducts a week-long awareness campaign referred to as the Public Health Awareness Week every two years. Sadly, over the past 2 years, we were unable to embark on this kind of activity due to the ongoing COVID-19 pandemic. The Public Health Awareness Week is a week-long activity punctuated with different activities geared towards showcasing the many public health interventions undertaken by public health professionals both locally and internationally. This, we believe, will help create understanding among the populace on public health interventions and increase acceptance or uptake of the irreplaceable services we offer to the populace. The week-long activity also provides a common platform for public health professionals and other stakeholders to come together and discuss on finding solutions to pertinent local and global health threats. Furthermore, our members within the country also converge at their respective regions and embark on series of community engagement activities, in order to strengthen and magnify their routine activities. We also seized the opportunity during the week to recognize the exemplary achievement of some public health professionals around the country as a way of motivating both the awardees and the entire ministry. This year's theme for the week is Recovering from the COVID-19 Pandemic. Lessons learned and the role of a motivated public health workforce to prepare for and mitigate pandemics. The selection of this year's theme was informed by the devastating impact of the COVID-19 pandemic on our country and the world at large. The significance of being able to learn from the pandemic as a country in order to help us recover from the pandemic and prepare ourselves for possible future pandemics. Furthermore, this team, we believe, will be of immense benefit to our members as they play a crucial role in public health emergencies. I can remember at the beginning of the COVID-19 pandemic, some of our members who were not even staff of the Ministry of Health, notably our members who were currently on studies at various universities within and outside the country, were tasked to come and support the ministry in responding to the COVID-19 pandemic. By way of history, the first case of novel coronavirus was detected in China in December 2019, with the virus spreading rapidly to other countries across the world. This led the WHO to declare a public health emergency of international concern on 30th January 2020, and to characterize the outbreak as a pandemic on 11th March 2020. The WHO ended its public health emergency of international concern declaration on 5th May this year. But as of June 2020, continues to refer to it as a pandemic. However, even prior to this, some countries had already begun to regard COVID-19 as an endemic disease, signaling the beginning of the recovery phase of the pandemic. As of 18 June 2023, the pandemic had caused 767,000 million, rather 984,222 cases, and over 6 million confirmed deaths, ranking it the 5th most deadliest pandemic in the history of the world. From all indications, it is apparent that COVID-19 pandemic had caught us off guard, and we cannot fall for the same mistake in the future. Hence, it would be unwise not to recognize the lessons learned from the pandemic. Central in the arguments is the importance of supporting people to recover their livelihoods and well-being equitably and sustainably. Because in all disasters, there are much greater numbers of people affected by the crisis than physically harmed by the hazard. Most often than not, the recovery from a disaster or other crisis is a simple linear path, as it will seldom simply be a matter of reproducing what was there before. Nor should it necessarily be. Recovery is a process that is complicated, interacting with other dynamics in society, socially differentiated and living with uncertainty. Lessons learned. Some of the most significant lessons we learned from the COVID-19 pandemic is that the world is a global village, and what affects a particular geographical area can affect the entire globe in no time. Moving forward, countries should know that this disease doesn't know any boundary, and affluent countries should be willing to extend a helping hand to weaker countries to put in place necessary infrastructure to effectively deal with future pandemics. Another significant lesson is the low level of acceptance of some key public health interventions during the pandemic. Key among those was vaccine hesitancy, especially in low and middle income countries. This reminds me of a statement by Lane S. Wang, and I quote, "Public health depends on winning over hearts and minds. It is not enough to just have a good policy, you have to convince people to actually follow it." Unquote. We should therefore strengthen our community engagement activities to win over the minds of the people we serve if we want to improve the acceptance of our interventions. Another significant lesson I want to emphasize is the huge discrepancy that exists between countries with regards to access to health infrastructure and commodities during the pandemic. This was evident in the accessibility about the importance of public health interventions in keeping our beloved country safe. The association conducts a week-long awareness campaign referred to as the Public Health Awareness Week every two years. Sadly, over the past 2 years, we were unable to embark on this kind of activity due to the ongoing COVID-19 pandemic. The Public Health Awareness Week is a week-long activity punctuated with different activities geared towards showcasing the many public health interventions undertaken by public health professionals both locally and internationally. This, we believe, will help create understanding among the populace on public health interventions and increase acceptance or uptake of the irreplaceable services we offer to the populace. The week-long activity also provides a common platform for public health professionals and other stakeholders to come together and discuss on finding solutions to pertinent local and global health threats. Furthermore, our members within the country also converge at their respective regions and embark on a series of community engagement activities in order to strengthen and magnify their routine activities. We also seize the opportunity during the week to recognize the exemplary achievement of some public health professionals around the country as a way of motivating both the awardees and the entire ministry. This year's theme for the week is Recovering from the COVID-19 Pandemic, Lessons Learned and the Role of a Motivated Public Health Workforce to Prepare for and Mitigate.
To attend these week-long activities that is happening. And of course, we know some of the activities will be held in different regions. So wherever you might be, you need to at least attend some of these activities. As the President has stated, we're going to have, public health is about winning hearts and minds of the people. And of course, we need to understand that as public health professionals, we need also to have